Niko nje, si side yangu.
Okay. Now it's a bit better. Okay, so today we are on the minimizing the risk of contamination. So how can you be able to, and in this case, on some of the few ways on which you're supposed to minimize cross-contamination when you're offering first aid. In this case, like we discussed, we said that hand washing is very key. And when you are on any incident, you should always be on gloves, especially when you are handling body fluids. So in this case, you need to know how you're supposed to put on the gloves, how you're supposed to remove them to avoid even contaminating even your body with the body fluids. Also, the other key thing is that you're supposed to cover your mouth and nose to avoid sneezing directly or breathing directly to an open wound or to the casualty who you are treating. So those were the key things. You went through, I hope you listened to the videos. You're able to follow the videos on hand washing. And that was just a simple way of on how you're supposed to do hand washing, following the 10 steps. And I don't want to go into detail into that because you already understood that. And I hope you practiced. Firdosa. Hello, Firdosa.
Yes, madam.
Did you try to practice
madam.
the 10 steps of hand washing? You know, this is the only way you can understand what we mean, eh? Did you try to practice?
Through practically, no.
Firdosa, I believe there is a tap around your home.
Yeah.
Jane. Hello, Jane. Yes. Have you tried to practice the 10 steps of hand washing?
Not yet.
You need to do that if you really need to understand. But did you watch the video?
Yeah.
Okay. You need to watch that video and try to do it on your own, such that when you have such a question during examination, it will be very easy for you. So since it's something that you already have practiced. So Firdosa, you need to do that. Eh?
Yes,
try to do the hand washing. Try to do the hand washing, all those steps. So I don't want to go into detail into that. Then the other one is how to put on gloves. Yes, the using of the protective gloves. So I believe you have ever seen these gloves. They may be of any color. It can be cream, it can be white, it can be blue, purple. But so long as they are used for the purposes of, so long as they are latex free, those are the ones which are used for the purposes of, when you're handling any emergency. So you know, by the term latex free, you know, we have some other gloves. For example, Jane is coming from hospitality department. In this case, there is some other gloves which are more polythene, and they are used for mixing maybe you're mixing the flour, you are mixing the colors in the food, especially when you're baking. So in this case, there are other gloves that they use, or the ones which they use for oven. So in this case, the gloves we are talking about here, they are the latex free one, the ones which are used for the medical purposes actually. So here we are taking into consideration that you are offering first aid. Maybe a person on your working area have been maybe have a cut. How can you handle that person? So in this case, you're not supposed to handle any person. You're not supposed to offer first aid services when you're not on this protective equipment. You should be on gloves, especially the gloves, especially when you're handling any wound, any blood related issues. So how to put on gloves? Also, I uploaded another video such that you can be able to see physically how they are doing this. Like, okay, the first step always, before you put on gloves, you should wash your hand. Also, you have to put into consideration, if you have a wound yourself, you have to ensure that you have wrapped your wound before you wear gloves. You have to wrap it. You have to ensure that you have a bandage, which is supposed to be waterproof. It should not allow any fluid inside your wound. Then you wear the gloves before you act. So when you are wearing the gloves, there are these steps whereby you're supposed to hold one gloves by the top and pull it on. Then do not touch the main part of the gloves with your finger. Then pick the second glove with the gloved hand. since the glove is already started, it's already clean. So you hold the other gloves with the gloved hand, and now that can help you to put on in the other hand. And then removing the glove, this is the key part. How do you remove the gloves, especially the soiled one, the one which already maybe have come into contact with the blood of a person or any other body fluid? So how do you remove it? I believe there are some diagrams here which can help us to understand better. How do you remove the gloves now? The first step, you can be able to see, I believe you can be able to see my screen here. So the first step is touching only the outer side surface. Pull the glove off your hand from it into a ball and hold it in the palm of your gloved hand. So you see how this person is doing it. So you remove from the outer surface, and then you form it a ball that is from the inside. Then you hold it on the other hand that is already gloved. Then the second step is insert the finger under the rim of the glove on your other hand. So you are inserting inside the other glove, not on the, do not touch with your bare hand on the outer surface of the other glove. So you're inserting from the inner part, from your a space whereby you are holding your hand, your inner part of that is your hand inside the glove. Then on the third part, you pull the glove off the hand, trapping the old glove inside and discard appropriately. So you're supposed to remove it in a way that you are still holding the other glove, that is the first glove, and you're supposed to form ball with the other. So as in you remove them together, holding the other one inside this one. So that one you are preventing coming into contact with the soiled part of the glove. Then lastly, you wash your hand properly. So those are a few steps, and I believe there is a video you can watch. They're trying to summarize those steps. Then the last step is how do you deal with the waste? We are talking about you're supposed to handle the waste appropriately. So in this case, there are different types of waste, and they're supposed to be placed in different types of the waste bin if they are available. So once you have treated the casualty, all the soiled materials must be disposed of carefully to prevent the spread of infection. So in this case, the soiled material, we mean the one that have come into contact with the body fluid of a casualty. So place the items such as dressing or gloves in the plastic bag, ideally the biohazard bag, that is if you have it, but they should be in a plastic bag, and give it to the emergency service. That is when they arrive. You're supposed to give them to the emergency service, because for them, they know where they will go to dispose that waste. You don't just dispose the used gloves anyhowly, so you have to handle it appropriately. Seal the bag tightly and label it to show it contains clinical waste. Put the sharp object, including the needle, in a plastic container and known as sharp container, which is usually red. If no sharp container available, put used needle in a jar with a screw top and give it to the emergency medical for disposal, medical technicians for disposal. That is if you handled any sharp object. Then here we have a diagram which is showing that where you're supposed to place different types of waste. I don't know whether it is clear on your side. Let me try to enlarge it. But I believe you can be able to see the different colors of the bin. So these are the most commonly used bin. You can find them in the hospitals in most of the cases, where you're supposed to ensure that you place waste in the most appropriate bin. So if you come across a green one is meant for the waste from it can be kitchen waste, papers, tissues, and water bottle, or so it is waste that is not contaminated with any chemical or any clinical waste. So in this case, these are the general waste. They're supposed to be placed in a green bin. So these are supposed to be here down. We have where it's supposed to be disposed. So the green waste can be disposed in a secured land filling, as in it can just be buried. It can be buried in a land. And then we have the red one. So for the red, you're supposed to place the infected plastic, or they can be plastic or metallic. For example, the syringes, the gloves, the plastic waste. It can be even be the needles and so on. The infective one. Okay, but we have the infective waste, whereby you're supposed to place the soiled, anatomical, the chemical, liquid. Okay, all the waste that come into contact with the soiled part of a blood fluid, body fluid, that is. So in this case, this is yellow. So where are you supposed to put these two waste? These two waste, they can be deep buried, or they can be secured in a landfilling. And actually, if it is infective waste, they're supposed to be they can be autoclaving. You know, autoclaving, it means that it will be burned to prevent any type of infection. Then we have a blue one, whereby you're supposed to put any glasswares. Then the red one, like I was trying to explain about the red one, the red container. Okay, this one is supposed to be for sharp object. Okay, you may have this type, or the normal red, the normal bin. You may not even, actually, this is not common. What is common is this red bin. So this is where you put any infected plastic and the sharp needles. This is not commonly used. And this is supposed to be, it can be taken to autoclaving, whereby it will be burnt down in a very high temperatures, maybe like in an incinerator, or it can be buried in a sharp, in a very as in deep pit. Yeah, so those are the different types of bins that you can come across with the different colors. So you have to note where you're supposed to place a specific waste. But the most common one, they are actually the most common one in the hospital. You will find a red one, you will find a yellow one, and maybe a black one. A black one is for the normal waste. It can be the waste for the green, or the waste for the blue. So that is mostly, it is placed in a black waste container. But for the red one, you have to put the red waste, and as in the specific waste, and for the yellow one, this waste. Okay, then how do you deal with a casualty? That is the last thing that I want us to discuss today. And this, we tried to discuss this yesterday, but Firdosa said that she cannot understand. Firdosa?
Yes, madam.
Did you write these notes on dealing with a casualty?
Yeah.
Were you able to understand these steps?
Kidogo.
Kidogo. Okay, hoping now at the end of this lesson you will have understood what we mean. Okay. What happened is you will meet different type of persons. You will meet different type of people with different type of injuries, and some of them may accept you to offer the first aid, or may not. So how do you deal with all these kind of situations? So you find that casualty at the first step, depending with the nature of the emergency, they may be frightened, depending with the nature. So for your case, as the first aider, you need to remain calm, and as in you need to remain calm and take charge of the situation, such that the casualty needs to believe in you first, because you are the first person who have arrived, such that you know this. You expected that you act before the emergency help arrive, or before the more experienced people get to the site. So in this case, you are acting as in you want to preserve life of a person. You want to save someone from situations such as excessive bleeding, which can cause death. So in this case, you remain calm and take charge of the situation. But like it is always, when the emergency help or people who are more experienced arrive, you're supposed to stand back, or to allow them to do their work. But you can hand over any information that you have about a casualty, or how the incident occurred. So a few steps, or a few key things that you need to note is, one, it's about building the trust. You need to establish trust between you and the casualty. First, you introduce yourself. The second thing, you need to know the name of the person you're handling, such that you will address them with the his or her name. Another thing, you can kneel down to ensure that you're on the same level with the casualty. Then explain what is happening. Then how do you explain, as in you can help the casualty understand what is really happening, or because some of them may not be aware what has really happened, because emergency situation or some incident occur very fast, like an accident. Then you need to respect the casualty at all time, as in even the language that you use should be kind language and such that the casualty, and then you refer them with dignity. Then the other thing is about how do you communicate with the casualty. So this way you need to show respect, and you respect the people wishes. If someone don't want to be treated, do not force them. Then in case a casualty as in want to be treated in a particular way, you respect that, because they may accept or reject your services depending on their situation. If you don't understand the language that they are speaking, you can have a bystander or a person to explain to you, someone who is, those people who are just watching the incident, they are the bystanders. They can help you, maybe they understand the language of the casualty, to interpret to you, or you can use the sign language that is easily understood. This will help in the communication between you and the casualty. And then the other thing is about the listening skill. You need to use both verbal and non-verbal listening skills, such as making eye contact, but look away now and then, so as not to stare at the casualty, because they may be on a very bad condition. So do not stare at them, but you need to keep eye contact. Those are some non-verbal listening skill. You know, when you look at someone, you can tell the movement of the mouth, and you can be able even to interpret what they're trying to say. Then another way of listening is do not speak too loudly. Keep the instructions simple, or use short sentence and simple words that can be understood. Then use simple hand gestures and movements. All these, they are helping you to communicate with the casualty. Do not interrupt the casualty, but always acknowledge what you are told. For example, summarize what the casualty has told you to show that you understand. Like when the casualty is trying to explain what is happening or what happened, and so on. You know, a casualty can be anyone. Like, you know, like for example, if a person gets a heart attack, how can you be able to assist that person, or an epileptic person, or a person faint? So you need to listen to understand what happened. A person just fallen, so they will explain to you what they felt before, and you can be able to tell it's a normal faint, or maybe it's a person is epileptic or convulsive patient, and so on. So we will discuss those conditions and how you can be able to manage them. So like I said, when a casualty resists, do not force it, do not argue with the casualty, and always you should know when to act. But like we said on the last lesson, is that if you feel like a person is at risk of maybe like a point whereby they have excessive bleeding and they have refused your help, in this case, you're supposed to observe at a distance such that you can tell when a person is going to, a person is becoming unconscious, such that there is a way in which you need to help, to assist, of which we will discuss later on how to handle unconscious patient. You know, unconscious, it means that they cannot be able even to tell, like they are not themselves, and so on, or they are just acting like they acting like someone who is dead, but they may be still breathing. So how do you act in that situation? So do we have any question? Firdosa, have you tried to understand?
Yeah, ma'am.
Okay. Jen, hello Jen. Hello Jen, are you with us? Oh, she left. Oh, okay, I believe it's bundle issues. Okay, Firdosa, that's it for today. If you don't have any other question, you can have a good day, because our time is almost up. So the other thing, it's about how do you care for the belongings of the casualty. Like you have to ensure that their things are safe. They won't be stolen around there. Then, okay, something very important I've forgotten to mention is about keeping notes. You have to ensure that, like, you need to write everything that the casualty is telling you, or you need to write about that incident, such that when the medical emergency help arrive, you provide them with that information since they require it for their medical history, to maintain the medical history. So in this case, if a casualty is on a certain drug, you need to record. Like if you have given them painkiller, you need to record. And some brief information like the name, age, gender, the contact, the history of the incident or the illness, the brief description of any injuries, and so on. So these are things that you need to note, but ensure that any medical information about a person is supposed to be handled with highest level of confidentiality, and it is only supposed to be shared with the medical help that arrives. So yeah. Then lastly is about the use of medication. A first aider, you are only supposed to give the painkillers, as in to manage the general pain. But in case a casualty is on a certain medication, you can assist them to take it. For example, like I gave an example of an asthmatic patient, you can give them, you can assist them to use an inhaler and so on. Yeah, but you're not supposed to give any other medication. Yeah, so that's it for today. Have a good day.